Okay.
Hey, David, Dan,
Yes.
Yes.
I had a large picture displaying, earlier it was Mr. Barnes, now I have nothing.
I couldn't understand.
There we go.
Yeah, mine's come and gone several times.
Well, it's not because anybody's logged on other than me.
I think it's probably your stuff, Joe. I see Mr. Davidson in the room.
Guys, this is Walter. Can I ask if somebody called in from a number starting 480 area code?
Oh, here.
That's me, Walter, Sharon.
Okay.
I've got 1201 and I see all participants. Are we ready to go?
Ready to rock.
All right. Welcome to reconvening of the Oklahoma County Public Safety Committee. If speaking, please mute your computer or your phone. Do a roll call. David Barnes is here. And Matthews.
Here.
Joe Blau.
Here.
Michael Taylor. Michael Taylor. Anybody getting audio?
Yeah, we got it. He said here.
Okay. All righty. Thank you. And Mr. Davidson.
Here.
Very good. All members.
Mr. Chairman, the motion that we return to open session.
Got a motion? Do I hear a second?
Second.
Got a motion and a second to return to open session. David Barnes, aye. Mr. Matthews?
Aye.
Mr. Blau?
Aye.
Mr. Taylor?
Aye.
And Mr. Davidson?
Aye.
All right, back in session. And item number one, discussion possible action to set date, time, and place, meeting to reconvene if we have technical difficulties that we cannot correct in 30 minutes. Any recommendations?
Well, technically, we need to have a motion to reopen that item. And I would make that motion.
Okay.
Second.
Got a motion second. Barnes is aye. Mr. Matthews?
Dan, it looks like you're muted. There you go.
Thank you.
Mr. Matthews?
Aye.
All right, thank you, sir. Mr. Blau?
Aye.
Mr. Taylor?
Aye.
And Mr. Davidson?
Aye.
Very good. Item has been voted to reopen. Any recommendations on a time should we experience technical difficulty?
Noon tomorrow.
Second.
Got a motion and a second for noon on Wednesday. All in favor? No, can't do that. Barnes says aye. Dan Matthews?
Aye.
Joe Blau?
Aye.
Michael Taylor?
Aye.
And Miles Davison.
Aye.
Motion passed. Reconvene Wednesday should we experience technical difficulty. All right, item number 3. I have a motion to reopen item number 3.
So moved.
Second.
Got a motion second. Barnes, aye. Mr. Matthews?
Aye.
Mr. Blau?
Aye.
Mr. Taylor?
Aye.
And Mr. Davison?
Aye.
Aye. Item number 3, reopen emergency management report. I'm not going to go through some of the details that we normally do. Obviously, the president's stay-at-home guidelines are still in place, and we are under a major disaster declaration, including all 77 counties. That is a presidential disaster declaration. And there'll be more information coming on that as we move forward in regards to being able to file for benefits under a disaster declaration. Numbers just updated about 5 minutes before this meeting initiated. Oklahoma is now looking at 1,472 positive test results with 67 fatalities. Oklahoma County has remained steady since yesterday with 11 fatalities. Cleveland County has gone to 12, and Tulsa County has jumped from 8 to 14. We have 1,436 negative test results in Oklahoma County, in Oklahoma, and 376 hospitalized. We now have active cases in 62 counties. State Department of Health has expanded the number of drive-through locations. We now have 74 drive-through test sites in the state, including some counties that have multiples. And in Oklahoma City County, we still have the site that was previously in place. They are now scheduling appointments without a medical referral. An appointment is still required, and the triage hotline is area code 405-425-4489. They take calls Monday through Friday, 8 a.m. to 4:30 p.m. Again, medical referrals for the Oklahoma County site are accepted, but they are no longer required. They do stress, do not show up without an appointment. There's some screening criteria. You call that number, they will tell you whether to come or not. And if they agree that you need to come for a test, they will then set that schedule for you. Cleveland County still has 2 sites by appointment only, and numbers there are 321-4048 or 794-1591. We are still under the gubernatorial declaration of a catastrophic public health emergency. The legislature convened yesterday to confirm that, and they in fact did that. So those acts and those measures are in place for the governor's office. That's again, including all 77 counties through April 30th. Governor's travel orders for people coming from various states is still in place, quarantine for 14 days. Still looking at an April 22nd now through possibly the 25th projected peak date for Oklahoma for the Institute for Health Metrics and Evaluation. And I would stress that for some reason they can do projections for April 22nd through 25th based on what should be in place through May, being social distancing through May. I'm not personally sure how that works, but that's what they tell us. And Christy Jernigan Marshall at Oklahoma County Social Services continues to be very engaged, keeping me advised, and I've seen emails with elected officials and other offices. Lots of stuff going on there. She did say something that I think bears at least mentioning, that the duration of this particular event, and particularly the social distancing measures, are starting to have their toll. We know they're taking their toll on the general population, but the senior population is extremely hard hit. And I would strongly encourage anybody who has family members or friends or senior population, just give them a call, touch base with them, and encourage that social interaction by phone, or if they happen to be tech savvy, do it by computer. I know it's made a big difference for my dad. He's 82 years old, and I used to visit him 6 days a week. I've been over there in the last 2 weeks, but I call every day, and I encourage you to do the same thing to really help these folks out. And thank you, Christy, for that information. In Oklahoma County, the statistics, we are now looking at 303 positive test results. And as I said earlier, still with 11 fatalities. The Oklahoma City County Health Department nurse hotline is 425-4489. And the state hotline is 877-215-336. For persons having questions in regards to the coronavirus or COVID-19, they can call those numbers and get additional information and have your questions hopefully answered. Christie's, again, still working with multiple partners, the Homeless Alliance and different folks on the alternative care homeless shelters. Those are still a work in progress. Staffing issues still plague that particular project, although discussions continue. The Alternative Care Site Initiative, this is not the same as the homeless. This is the Oklahoma Hospital Association working with the National Guard. Then the activation here, should that come about, the formal request has been placed at the state and the governor's office, and I've not heard a response in regard to that request, but this would be a medical deployment, medical mission for them only to assist with the Alternative Care Site Initiative. And the YMCA and Office of Management Enterprise Services continues to offer transport for that purposes. Some additional facilities for use in that: OU, OSU, SNU, UCO, and Oklahoma Christian are involved in discussions and planning to potentially house first responder and healthcare providers that are needing quarantine. And there are several area hotels and similar facilities that are also involved in those discussions. PPE continues to be a significant issue as we see nationwide, actually, but some resources are being provided. Oklahoma County Office of Emergency Management, we have an after action this afternoon at 1:30 with my staff regarding the point of dispense that we did last Friday and Saturday for first responder PPE in Oklahoma County. And we have another much larger piece of that coming up. We don't know what day we're going to be initiating that. Been working with planning with the state. We're going to be providing PPE apparently, again, for first responder agencies throughout Oklahoma County. And we're also going to be a supply point for 3 surrounding counties and 1 additional municipality outside of Oklahoma County. That planning is almost complete. And the after action that we have this afternoon at 1:30 certainly bring any additional issues there should they be there. Internal Oklahoma County government, again, ReadyOp is being emphasized, and if people are not participating, encourage them to do so. We're still under an emergency declaration approved March 25th by the Board of County Commissioners. And again, according to a news report that I saw yesterday, the Oklahoma County Court Clerk's Office has sent specific guidance regarding marriage licenses out where the paperwork needs to be completely prepared and brought with the couples wishing to get a marriage license. And an appointment is necessary. And that, to my understanding, is still taking place in the jury assembly room on the first floor of the county annex. I also saw a note where Oklahoma City of Oklahoma City, is now taking applications through April 17th for small businesses within the Oklahoma City limits to apply for disaster relief. I would stress that is not associated with or tied to FEMA reimbursement or the disaster declaration. That is an internal Oklahoma City of governmental function. A couple of notable items. The Oklahoma Medical Reserve Corps, the MRC, is still soliciting for volunteers, and that can be medical or non-medical personnel. And they are doing that in anticipation of a medical surge in Oklahoma should it arrive or should it occur. And there are a large variety of jobs and tasks that are available. Again, you don't have to be medically trained per se. They can use warehousing staff, a number of different things. So if interested in participating in that, go to the okmrc.org website for information or to volunteer. And it's important, as with any disaster, that people volunteer early so that they can be properly trained and the vetting can take place and they can be built into the organizational structure as opposed to coming in later and causing additional challenges because of the activity level. Warning signs for the virus: continued trouble breathing, persistent pain or pressure in chest, new confusion or inability to arouse, waking and bluish lip or face. Stay-at-home orders are in place in 43 states and the District of Columbia. And personal protective measures remain consistent, consisting of frequent hand washing, covering the cough or sneeze, social distancing, 6 feet or greater between people, and avoiding groups, and stay home. Recommendation to open packages outside of the home or work area, disinfect the items, and properly discard shipping materials without taking them into the workspace of the home. American Red Cross and Oklahoma Blood Institute still requesting blood donors. If interested in that, the blood supply is low and they're needing donors. Still struggling in many areas with false information. We encourage you to avoid social media reports and information unless you have known credible sources. And authorization letters for essential services or personnel are still not being implemented that I'm aware of anywhere in the state of Oklahoma. And view statistics realistically. I would also caution, as we mentioned before, the caseload and the fatality statistics and projections that we're seeing at times can be frustrating. And to be honest with you, I think they're incapable of specifically accurate predictions due to a lot of dynamic factors. And as I mentioned earlier, the peak for Oklahoma is anticipated somewhere between April 22nd and April 25th. But that peak timeline is dependent upon social distancing through May. I'm not really sure how you identify a peak in mid to late April, dependent upon factors in May, but that's what they're saying. Interesting too, the city of Guthrie is now requiring face masks to be worn in public places, and there was another city in far southwest Oklahoma that was doing that as well. We currently do not see that being implemented anywhere else here in central Oklahoma, but we're watching for that. Mr. Blau was gracious enough to touch base with the deputies out front, and we had 105 people come through the front doors yesterday, so that's up a little bit. They had indicated to me that they were expecting a larger number of prisoners in the jail yesterday, but we do not have that count. And with the exception of further discussion or questions, I believe that concludes my report for today.
Motion to receive report.
Second.
I think you got a motion second to receive the report. David Barnes is an aye. Mr. Matthews,
Aye.
Mr. Blau,
Aye.
Taylor,
Aye.
and Mr. Davidson.
Aye.
Thank you. Motion pass. Item number 4. Need a motion to be open for information from BOCC departments.
So moved.
Got a motion
Second.
and a second. Barnes is aye. Mr. Matthews,
Aye.
Mr. Blau,
Aye.
Mr. Taylor,
Aye.
and Mr. Davidson.
Aye.
Thank you. Motion passed. Item number 4, discussion, review, and possible action regarding presentation from BOCC departments. Do we have any BOCC departments represented that would like to share, or any reports received via email or other means?
They're all shaking their head no frantically for the 2 that are here.
That would probably be MIS and also facility management, I would guess. No reports from them?
That's a good guess. That's a no. Keith, have you had any opportunity to talk with the drug testing company? Okay.
Okay, I'm saying no formal action. Pardon?
I'd say probably no action.
Thank you, sir. No action in regard to item number 4. Need a motion to reopen item number 5, discussion and possible action regarding presentation from facilities management.
Do you have anything, Keith?
So moved.
Keith has nothing new.
All right, no action on item number 5. And item number 6, discussion, review, and possible action regarding presentation from Oklahoma County Clerk, Oklahoma County Clerk, Oklahoma County Treasurer, County Sheriff, or Oklahoma County Assessor's Offices. Anyone present or information provided for briefing from those departments?
Nobody is present.
Okay. So I'm going to say no action in regard to item number 6. Any further discussion or comments we need to bring up to reopen any items? Hearing none, we have item number 7, discussion, possible action to determine the next meeting date and time.
I believe, David, that I've already taken care of that.
For the meeting on Monday?
Yes.
Correct.
Okay. Very good.
Desire to recess this meeting until tomorrow.
All right. What time would you propose, Mr. Blau?
Let's just be consistent and stay with noon.
Okay. I'm good with that. Is that the form of a motion?
Yes, sir.
Okay. Do I hear a second?
Second.
Second.
Motion second. Barnes is aye. Mr. Matthews?
Aye.
Mr. Blau?
Aye.
Mr. Taylor?
Aye.
And Mr. Davidson?
Aye.
Very good. Thank you, gentlemen. We will recess until tomorrow, Wednesday at 12 o'clock noon. Thank you for your time and participation.
Thanks.